Hello, this is Dr. Stanley Lang, and welcome to this video. The subject today is on neurological difficulties and learning difficulties and the possible connection with Lyme disease. I recently saw a patient who has been struggling with a couple of significant neurological difficulties for a few years. The patient's still a child, and associated with this are some problems with paying attention in class and learning well. So one of the things that we started to talk about early on, that is when I talked to the family, was the possibility that some of this that we were looking at could be Lyme disease. And so we actually did a blood test which proved that he did indeed have Lyme disease, and so started to treat him with usual antibiotic regimen, and lo and behold, he got better. His neurological symptom, which I won't detail here, got better, but also his ability to concentrate in class got better. And so it seemed pretty obvious that this particular neurological symptom and his diagnosis of Lyme disease were probably connected. Fast forward several months, he's off the antibiotic, he's at somewhat of a stable place, and then he starts to get his symptoms back. So two things happened. We restarted antibiotic therapy and referred him to a couple of specialists at a major pediatric center. Now, both of these specialists saw this patient and said there was no way that this was caused by Lyme disease, and started him on some other medication that I'll just say didn't help him, actually impaired him a little bit, and stopped his antibiotics. And so he started to get worse again. So we restarted antibiotic therapy, and he slowly started to get better. Then what happened was that he started to have the common problem with antibiotic therapy, which is his stomach was becoming more and more upset. And that caused us to have to stop antibiotic therapy. And so we started to use the elements of the natural Lyme disease treatment program that we've put together. And now, several weeks later, his symptoms have completely resolved. In fact, he's doing better than he was doing when he was on the antibiotic. Now, that doesn't prove that this program is better than an antibiotic. Doesn't prove anything, really. It just shows by association that when he started this natural strategy, that he got over all of his Lyme symptoms and he was able to focus in class better. Now, whether he's able to focus in class better because something that was impairing his ability that was part of the Lyme disease was directly treated by the program, or he's simply less distracted by these other symptoms he was having, who knows? The point is he's able to focus better. Now, I believe that a lot of children that are dealing with different types of behavioral issues, major behavioral issues that prevent them from learning, and this would include severe forms or even not so severe forms of attention deficit disorder or some expressions of autism. Some of these may in fact be manifestations of Lyme disease. And there's been multiple times when people have documented that they had a positive test and these kind of symptoms. But sometimes people simply don't have access to the information to know that whether they're dealing with Lyme disease or not. So the question is, well, is it reasonable to try a natural strategy that does help to treat the Lyme disease when you don't know for sure? And my answer to that is, as long as it's non-toxic, as long as it only helps the body become healthier, it's probably a reasonable thing to do. At least from my perspective, if it was my child, I would consider it reasonable to do. And so I want to give to you a little free report that has the 4 elements of the natural program that we've put together. Now you can piece your own natural program together, and you can try to piece together from these 4 points your own program. But I'd like to give you the free report, and all you need to do is click on the link that's either on this video or below the video, and it'll take you to a page where you can trade your email address for the free report so we can send it to you. So I hope you found this helpful as you consider your options, and that you consider the possibility that, especially if the treatments that have been offered for your child haven't worked that well, that you consider the possibility that maybe Lyme disease is part of the picture. Just because the Lyme test is negative doesn't prove that it's not Lyme disease. And so I want to encourage you to give that a consideration, because some of the time, maybe a lot of the time, Lyme disease is part of the picture. So I wish you well. God bless and have a good day.